mute. Okay, anyone else? All right, great. Okay, we are just about to go live. So let's begin the session in a few seconds. Yes, we are live. Okay, good evening to one and all, and welcome again to Parent Tribe by SuperBottoms, and welcome to this wonderful evening session with Dr. Shwetha Prasad. Okay, there's a lot to talk about today's session, but to begin with, let's just all smile. Okay, let's keep our cameras on. That will be a great way to keep it engaging. Keep your cameras on and do smile. Tribers, you're also allowed to smile. Just smile. That's the best thing you can do. And I think smiling is such a wonderful feeling. The minute you see someone smile, you know that that person is so happy, the person is connected to you. I think there's a lot of expression that comes out when it comes to smile, right? So today we are going to be talking a lot about it, but mainly about oral care for the little ones. And we have with us Dr. Shwetha Prasad, who is on the other side of the of the hot seat today. She is going to be the expert on the session. She's always been the one who is going to be hosting the session on Parent Tribe, but today we have her in her original format, which is she is a dental expert, and we have her on Tribe today. So a quick introduction about her. Spreading smiles is her profession. So she is a dentist with 11 years of experience. She is based in Pune. She did her BDS from Bharati Vidyapeeth, Pune. She specializes in cosmetic smile designing, root canal treatments, and pediatric dental treatments. Today, she will be answering a lot of questions about how to take care of your children's dental hygiene. I'm sure you all have loads of questions to ask, so don't forget to drop them in the comment section. We have noted all your little tribal questions, but in case you have more questions, you can drop them in the comment section and we'd be more than happy to answer them during the session. She will be busting so many common myths that we come across about oral care and also sharing some amazing tips on how to keep child's mouth free from cavities. So welcome to the session, Dr. Potdar. I'm very happy to address you this way, and a hearty welcome to you. You want to add in a line or two?
Thank you so much for the warm introduction, and thank you for the, I must say that it's lovely being on the other side of the session once in a while. So thank you so much for having me over today, Shweta.
We are glad that you're there on the other side today. And I'm going to shoot a lot of questions to you. Of course, I have noted a few of them, but I'm sure our tribers also have so many questions to ask. So I'm not going to waste too much time. I'm just going to, quickly plunge into all the questions that we have received. So first of all, how do we clean a newborn's mouth? We'll start from that stage. I think that's a great way to start.
Yeah. So I think, a lot of parents have this misconception in mind that you do not need to clean a newborn baby's mouth. But the moment the baby is born, you need to start maintaining the baby's oral hygiene, because now the baby's mouth is going to be open. The baby is constantly going to be drinking the mother's milk. There are things going in the baby's mouth. So the oral cavity needs to be cleaned. But in case of babies, we need to be very careful about what exactly goes in their mouth, because the immunity hasn't yet developed, right? So we do not use a brush, because newborn babies do not have any teeth in their mouth.
Sorry, I'll just mute all of them 1 second.
Newborn babies have toothless gums, which are called gum pads. And in that case, what you need to do is take a gauze piece, wrap it around your finger, or maybe a handkerchief, a clean handkerchief, wrap it around your finger. And after every feed, you need to clean your baby's mouth. So take the finger-clad cloth clad finger and move it all over your baby's gums, between the lips and the gums, and between the tongue and the gums also. So these are the areas where typically the milk is going to be accumulated after the baby is done drinking the milk. And if it stays there, it is eventually going to start fermenting and start causing bad breath to the baby. So make sure you clean the baby's mouth with a damp cloth wrapped around your fingers, and make sure that you clean the baby's tongue as well, because the baby's tongue definitely needs to be clean. That again is another misconception that new parents have, that we don't need to clean a baby's tongue. A baby's tongue has small filaments protruding out of it, which usually tend to harbor a lot of food particles and a lot of milk. And if not cleaned on a regular basis, they will again start smelling and giving a white coat on the baby's tongue.
Okay.
So, and we never know when that white coat suddenly transforms into thrush. So we really have to be mindful of cleaning the baby's tongue after every feed.
Nice. So you told us what should be done. Now I would also like to ask you, what should not be done? I mean, there's so many traditional methods that our Indians follow when it comes to cleaning mouth, right? So what are certain things that you've come across which should ideally not be done, which will harm their teeth? Eventually it's going to become permanent teeth after their milky teeth is out and everything. So what should we avoid doing?
Yeah. So first, you should avoid not cleaning the baby's mouth. Again, after you start that, the baby's gums are very strong. So it's okay if you wipe it with a cloth more than twice a day also while the baby is still breastfeeding. But one of the common questions that people ask me is, when do we start brushing baby's teeth? So baby starts getting teeth at the age of 6 months of age. The first tooth erupts. The lower front tooth will erupt at 6 months of age, variably plus or minus 1 or 2 months here and there. And as soon as you start seeing the first tooth inside baby's mouth, you need to start brushing their teeth. So you can use a finger brush like this. I don't know if it's visible, but you have silicone brushes like this, which you could put it in your finger and clean. So even in a newborn baby, if you do not want to use a cloth, at the age of 1 or 2 months, you can start switch to the silicone brush and start cleaning with the soft bristles on one side, and clean the baby's tongue with the rough side of this brush on the other side. So it's a great tool, but make sure you hold it very tight in your finger, because it's easily, it could go in the baby's mouth and come off your finger. So you need to hold it properly with these 2 fingers and then clean your baby's mouth, so the baby doesn't pull it inside the mouth. So that is one thing you have to be very careful about.
Okay.
Then
nice.
other things you can avoid is avoid giving baby sweet, added sugar, processed food. Give it to the baby as late as possible. Try not to introduce it to the baby at least for the first few years of life, because once they get used to it, if that is the first stage they are exposed to, then the age when their teeth are vulnerable to decay, then they will consume a lot of those foods at that age. So introducing those foods very late in life is a good way of preventing high dental caries causing foods.
Nice. But of course, after 6 months, we definitely do introduce at least, one by one, we introduce fruits, we introduce vegetables. Some definitely have that sweet texture in them, especially the fruits have a lot of sweet texture. So how do we handle that?
Yeah, usually natural sugars will not cause a lot of problem. Natural sugars are okay, but after eating anything, you need to make sure that the baby's mouth is clean. The one funda we have to be very clear about is that the food needs to be in baby's stomach and not in baby's mouth for a long time. So what happens is, when you consume food, there are bacteria in the mouth which will start fermenting the food inside the oral cavity. Okay, and once the food starts fermenting, there is acid that is released from that, and this acid will start attacking the tooth surface. Your tooth is made up of calcium, and this acid will start dissolving localized areas of your tooth. And when it dissolves those localized areas for a long period of time, you will see a cavity developing, like a pit inside your tooth, which we commonly refer to as a cavity. Okay. So dental decay is basically your tooth being dissolved in the acid that is formed inside your mouth due to non-cleaned food particles, which are there in your mouth for a long duration of time. So regular cleaning of your oral cavity, removing the food debris from your mouth, and eventually removing this acid from your mouth is the key to keeping your oral hygiene in a good condition.
Okay. Some kids have these, sorry, all these are my, like my questions, which probably I have experienced when Madhurya was in that state. So I have a lot of these simple questions that come across my mind when it comes to oral care. She used to keep food in her mouth like
Yeah.
for a while, even before chewing it or even before swallowing it. So it's like stagnant in her mouth for a while.
Yeah.
Then I say, come on, chew it, then swallow it. And then she, continues to do it. So in that case, how does it affect the dental, the oral hygiene?
Yeah. So, once in a while, it's okay to do that. In the long run, that habit could be detrimental for the dental hygiene because, but see, then again, you have to understand that the frequency of eating is not being spiked up and down every time. So just while having her meal, if she is retaining food in her mouth, then the acidity level is constant at one point. After she finishes her food, the saliva will take over, reduce the acidity in the mouth, and the teeth are protected all over again. But if the frequency of snacking is very high, then there is high spike of acidity in the mouth with every snack that the child consumes. So this frequent high of spikes of acid is also detrimental to the dental hygiene. So avoid frequent snacking. If the child wants or is insisting on having any kind of a sweet, any kind of a sticky food product, then try to give it at the end of the meal. So you can even use it as an incentive for the child to finish their healthy meal first. And then you could have probably this one piece of chocolate, or you could have this one piece of particular snack that you want to eat. So then you are preventing the frequent snacking between two meals. So there is no spike because of that one single snack, but the child's craving is also satisfied. So you could club it with a meal at the end of the meal.
Right. But it's okay to have meal itself. When they're having the meal itself, it's okay to kind of keep it in the mouth, and they take their own sweet time to chew and swallow. It's fine.
It's okay.
Okay. That's kind of satisfying for me, because I've always been worried about she keeping it in her mouth for a long time, and then only when I say she reminds to kind of swallow it. So that used to happen. That's a great no. Now we also want to know about teething. How do we deal with teething in babies?
Sorry, deal with
teething.
Teething, is it?
The pain, yeah.
Okay.
Process.
So So we need to understand that teething starts in children from the age of 6 months of age. The first tooth, the lower front incisor, will erupt in the oral cavity at 6 months of age, with a variation of 1 or 2 months here and there. And this process will continue up to 30 months of age. So up to 2.5 years of age.
Sorry, I just had to join in and keep.
Okay.
Yeah.
Sorry.
And every tooth has a different age of eruption. So it's not like teething is just limited to one single tooth, right? But usually the symptoms associated with teething are limited to early, say maybe up to 1.5 to 2 years. So every time a tooth is popping up in the mouth, you will see that the child has irritable gums, and the child will try to put everything in their mouth, right? So as a parent, what you can do is give them teethers to chew on, because they have irritated gums and they want to soothe their gums by chewing on something. And in that process, they will pick up everything and put in their mouth, which is clad with so many microorganisms, right? Instead, you can clean their toys regularly so that they don't have a lot of dirt going in their mouth and eventually in their bodies. You could give them teethers to chew on, which are dipped in cold water. So that cold teether will really soothe their gums and the inflammation that is there on their gums. Also, we need to understand that the teething irritation occurs only 2 to 3 days prior to the tooth actually erupting, breaking the gum and erupting into the oral cavity. It's not a prolonged process, unlike what everybody thinks like it is, okay? So every time the tooth is about to erupt in the oral cavity, for 2 to 3 days before that, the child will have irritably red gums. And then after the tooth erupts, that pain is going to go away. Now, the other symptoms that come along with teething typically are a little bit of fever, diarrhea, maybe vomiting, and that is per se not directly because of the erupting tooth, but that is because of all the things that the child is putting in their mouth. So it's a sequelae of the symptoms, not really because of teething itself. So we have to be careful about what the child is putting in their mouth, and if your child has fever, vomiting, or diarrhea, do not ignore it. The child needs to be treated for that, and it is not because of just the tooth being erupting in the mouth.
Thank you. I would like to now move on to that stage when the teeth is actually, it will eventually fall, right? So does this milk teeth really require a treatment when there is a decay?
Yes. So see, the milk teeth have a very, very important function in the child's mouth. Even if they are going to eventually fall off, we need to understand that. We need to understand.
Sorry, you'll have to unmute. I have muted you by mistake. Can you please unmute yourself?
Then I start with this one.
Am I audible now?
Yes, you're audible now. Thank you.
Okay. So first we need to understand that these milk teeth have a very vital function to serve in the oral cavity till they are there. So if, for example, a tooth is erupting in the mouth at 6 months of age, the last milk teeth to falls at the age of 12 years. So we need those teeth for the vital function of chewing till the age of 12. We need to retain those teeth. Also, apart from chewing, the other important functions that milk teeth perform are actually developing the facial muscles, giving support to the facial muscles and having the development of the facial anatomy during the vital ages of development, and also the speech development of the child. Okay. Also, these milk teeth work as space retainers for the permanent tooth to erupt. So we definitely have to work very hard to retain these milk teeth in the mouth till the time they exfoliate or fall off on their own. Due to any reason, if a milk tooth goes bad and it needs to be removed, then that space needs to be maintained with certain appliances that a dentist will give to the child, which are stuck inside the mouth. These are called space maintainers. Because if you just remove a tooth untimely, then there is a lot of time before the permanent successor of that tooth is to be erupting in the mouth. So you need to maintain that space. If other teeth come into that cavity and block that space, then the permanent teeth will not have any space to erupt in that area. Okay, so if for some reason a desert milk tooth is to be removed from the mouth, then go to your dentist and ask him to put a space maintainer in that space so that that space is retained. And the permanent tooth, whenever it has to come after a few years, will have its own space and there will be no crowding or misalignment of teeth in the later age.
Okay. Ideally, how long does this process take of the entire milk teeth falling off and, the permanent teeth to come back?
Yeah, so the first milk tooth falls at the age of 6 years. 6 years of age, they start exfoliating one by one naturally. And the last milk tooth falls off on its own at the age of 12, with a variation of 3 to 4 months here and there.
God, it takes 6 years. That's
yes, it takes 6 years.
Quite a long process. Okay. So a lot of tooth fairies are on the way then to pick up the tooth.
And in fact, the last molar, which is the third molar,
Mhm.
erupts in your oral cavity at the age of 17 to 21 years. So that is the average age for eruption of your third molar, the wisdom tooth.
Oh God. Okay. So that's when we become wise, basically.
Yes.
Okay. Nice.
And the milk teeth, there are only 20 teeth in your mouth. In the milk teeth set, whereas in the permanent teeth set, you have 32 teeth in your mouth. Removing the third molars, it will be 28.
Nice. A lot of new information that I'm learning today. I'm very, very, curious to learn more. How do we avoid this dental decay in kids? They are prone to eating chocolates. I mean, it's not, something we can avoid, because in schools also, they tend to see other children, they eat as well. But how do we avoid this? Not just school going children. I think even the younger ones also experience decay a lot more frequently these days, rather than, comparatively to before, or maybe it was there before. I'm not sure. How do we avoid that?
So see, avoiding is basically a lot of, it's related to your healthy eating habits and a good dental hygiene routine. So these are the two key factors to maintain a good dental health and prevent decays from happening. A common misconception is that just brushing once a day is enough. Again, brushing twice a day is very important. Eating less of processed food and combining these snack times with your meals is important to prevent frequent snacking and frequent acid hikes in the spikes within the mouth. And eating healthy or maybe fibrous food or chewy food. It's a very good habit within the Indian culture that we eat a soft at the end of every meal. So the basic function of eating soft is that it is a very fibrous food to chew on. And when you are just chewing on something, it will not really stick to the tooth surface. It might go between your teeth, but it will not stick to the tooth surface. It has very, very low sugar in it. Also, when you're chewing so much, there's a lot of saliva that's coming out, which is self-cleansing your teeth and mouth. So eating those chewing gums, I will not advise, because chewing gums usually come with a lot of added sugar in that. So they are quite counterproductive to the purpose. But chewy food like apples, carrots, these are very good for your oral hygiene, because when you're chewing, they are cleaning your teeth. They are stimulating a lot of saliva. And because they are very low in acid, they are not making low in sugars, they are not making your teeth vulnerable to decay.
Nice. Okay. That's again a new information to me. I'm going to try that. I'm sure she will not agree to eat all the apples and the carrots, but yeah, I am going to try that for sure. But is there any
Also,
other
one thing,
alternatives we can?
one thing I would like to add here is that these habits, eventually the family has to change these habits. If the child sees chocolates and sweets and aerated drinks at home easily available and everybody else is consuming them, the child will want to consume all of those as well, right? So the family changing the habits is also of utmost importance. You eating that and telling the child not to eat is never going to work. So just like all the other good habits we try to inculcate, this is another important vital habit we need to inculcate by changing the family behavior as well.
Nice. But it's okay, right? Once in a while, we can feel guilty of eating chocolates here and there. It's
See,
really
I'm telling you, as far as oral hygiene is concerned, these foods going in the stomach is important. They staying back in the mouth is what is our problem, causing decays.
okay.
So cleaning your mouth after eating it properly will not cause any harm to the oral hygiene. Baki is the pediatrician's job. They will tell you why you should not eat them.
I hope the toddlers here are not listening to this and asking for more chocolates. Mamas, don't complain. We are not promoting chocolates here. We are only promoting dental health care. So nice. I mean, that's a good thing to know. I mean, it's fine. It's still fine because I'm sure it's the age that they explore things and want to try and experiment on every texture of food. I guess chocolate is also one of them. It's fine to eat them, but I don't think it's good to keep them in the mouth. That's probably the gist of what you're trying to say. I hope I got that right.
Yes, totally.
Lovely. So is it good, like, for the smaller kids, we usually, after probably 1 year of age, we tend to give them milk in bottle. So is it good for them to keep the bottle in their mouth while they are sleeping? I mean, some kids tend to fall asleep all by themselves. So is it okay to keep it that way and sleep?
No. That is one habit which parents should really try to steer away from, because what happens is the child will hold the bottle in the mouth and eventually fall asleep. So there is a pool of milk which is accumulated in the child's mouth. Even if the child swallows, there is a lot of milk still accumulating between the gums and the lips and under the tongue. And it is highly fermentable in nature. So there is high amount of acid that is accumulated within the mouth after fermentation of milk. And typically when you see children who have this habit of falling asleep with a milk bottle, you will see all the front 6 teeth being decayed and just black stumps of teeth, just black toothpick-like projections, because it is a very rampant form of decay that spreads within the teeth due to milk bottle sleeping habit. And it is termed as milk bottle decay only in the textbooks also. So that is one habit which parents should never ever encourage within their children. Any form of sweet drink, some people give kids sugar water to fall asleep with. Some people give them milk with added sugar on top of that. So these are detrimental habits and should never be encouraged. Your kid's mouth should always be cleaned properly before they fall asleep. Because what happens is when the child has fallen asleep, the saliva secretion has reduced. The saliva contains a very important mineral called as calcium. And this calcium will turn the acidic environment into alkaline environment. So saliva is very important to protect your teeth from getting decayed. When the child falls asleep, the saliva secretion is reduced, the baby's swallowing has reduced. So the accumulation and the high spike of acid in the mouth will make it very vulnerable for not just dental decays, but for gum problems also. So ensure that the child's mouth, even adults, your mouth is extremely clean and free of any kind of food particles before you go to sleep.
Nice. Ruchi is actually asking us a related question. Is it the same with breastfeeding as well? Some kids tend to go off to sleep while feeding. So
there is no documented literature to support the fact that breast milk will cause dental decay. But there is extensive amount of documentation and literature on milk bottle decay. So far there have been no cases where there is extensive amount of dental decay due to breastfeeding and falling asleep.
Nice. So Ruchi, I hope that answers your question. I do have a lot of other questions, but I think there are so many questions in the comments. I would love to pick them up. So Priyanka is asking, is milk stains normal on baby of 16 months old? Is it something to be worried about? Okay.
So, stains is something you should always get checked from doctors, because what non-doctors perceive as stains could be internal discoloration or decay with the uppermost layer being still intact. So please visit a doctor and make sure it is diagnosed properly as to, is it just staining? Is it intrinsic discoloration of your tooth, or is it decay? So once you know what exactly it is, then your path of treatment will be determined. If it is just superficial staining, then the doctor will just remove it with an ultrasonic cleaner and you are good to go. If it is internal discoloration, but the tooth is still healthy, then it does not require any treatment. It's again, you're good to go. But if it is decay, then your doctor will advise you to go in for a filling or an appropriate treatment based on the X-ray.
Right. Okay. Shruti wants to know, how about desserts like kheer, laddus? Okay. There's a pakka, that sweet craving family, I guess, is like,
Yeah.
I also love all these sweets. So yeah.
So
Tell.
Shruti, what kind of food you are eating, what formulation or what kind of a texture you're giving the food does not matter. It is the added sugar which is the culprit. So if you can replace sugar with anything else, then would be better. But again, anything that is sweet in nature tends to ferment very soon. So the bacteria inside your mouth are going to love anything sweet. You could try to replace it with whatever. If it's sweet to your tongue, it is sweet to the bacteria's tongue as well, right? So they will eat it up as happily as they eat anything else that is sweet and ferment and create acid in the mouth at the same rate. So
yeah,
yeah,
I had
you
a similar
eventually need to
question.
clean
In
your
fact,
mouth.
Shruti has said the same thing, that she uses jaggery or palm sugar. Now, even is that also equally going to harm your teeth? Even I had the same question, actually.
Yes. So see, I'll tell you what. These topics or these substitutions become a topic of discussion when we are talking about glycemic index of food with relation to blood sugar levels, right? And glycemic index changes according to the food that we are eating. But in the oral cavity, it's not related to the blood sugar levels. It's related to the local environment inside the mouth, right? So if it is jaggery, it is maybe the glycemic index is less, but the sweetness is still the same. The process that is going to happen inside your mouth is still going to be the same. So as far as your oral hygiene is concerned, limit the intake of these foods and clean your mouth after eating them. So you are protecting your oral hygiene. The blood sugar levels are a different topic to discuss after that.
Yeah, that's true. Nilofer wants to know, I think my baby's side teeth are coming in first. Is this a problem?
Side teeth are coming first, right? So the ideal sequence of teeth erupting in the mouth is the front teeth. The lower front teeth will come first, the upper front teeth will come first, then the lower back teeth, and then the upper back teeth. So if the lower front teeth have not yet erupted, it's usually not a reason of concern at all. The sequence might change on its own because there is always a good amount of variation associated with these observations of age of eruption. But just if it bothers you, you could visit a dentist, get an X-ray done, and just determine whether those teeth have formed inside within the gum, but just not erupted. So if they have formed but not erupted, then you can just wait and watch. They will eventually erupt at one point of time. But if they are not formed, then maybe that's a different question altogether.
Right. We have, okay. This question, I think, is a hot favorite of every parent who kind of starts to brush the teeth. Which toothpaste to use for kids and which one to start with, when to start with. I think these are very common questions asked. So if you could throw some light on that.
Yes. So the American Dental Association recommends that you start using a smear of toothpaste as soon as you start seeing the first small white dot of a tooth inside the child's mouth. I personally, practically being a parent, would not recommend that because a toothpaste is not meant to be swallowed by children. It is meant only for use within the oral cavity, and it is specifically supposed to be spat out after its job is done. So it should never be ingested. So unless and until your child knows that you're not supposed to ingest it and the child understands to spit it out, that is when you should start using a toothpaste in your child's mouth. Okay. Usually up to 3 years of age, 4 years of age, when the child is able to communicate well, 3-4 years, that is the time when the child actually understands to spit out and not swallow, because usually children's toothpaste have a lot of sweeteners added to them, right? So they might tend to swallow them. So that is a parent's call when to start using. I believe when the child knows when to spit, start using a toothpaste. Use a bare minimum amount, just a speck of toothpaste on your child's toothbrush is more than sufficient. What the toothpaste basically does is it will make the environment of the mouth alkaline. So it is again made of calcium, and it will get rid of the acid, make the environment alkaline. Once its job is done, wash it out. Okay, so your teeth are protected. The fluoride in the toothpaste will combine with the enamel, the topmost protective layer of your tooth, and make it more resilient to decay. So having a fluoride in your toothpaste is very essential. So whenever you are starting a toothpaste in your child's mouth, ensure that it has fluoride. Kids toothpaste under 6 years of age should have 1000 ppm of fluoride. So it will be mentioned on the packaging. 1000 ppm of fluoride is what a pediatric toothpaste should usually have, and the child should spit it out. When up to 6 years of age, they can use any brand of pediatric toothpaste. After 6 years, they can switch to the regular toothpaste that the adults are using. And then any toothpaste is okay, but try to avoid any kind of powder directly. For example, a lot of people use charcoal. A lot of people use just homemade powders, homemade powders for cleaning their teeth because they think it's natural. But they tend to have a lot of scratching on your teeth. Also, when you're brushing, the main motive of you is cleaning the food debris from over your teeth. Your main motive is not to clean the upper layer, clean off the protective layer of your tooth, to strip it off, right? So don't use any extra abrasive material. Your teeth really need to be taken care of, because brushing is something, if you're doing it twice every day, you have to do it every single day of your life, then your tooth needs to be able to endure that kind of pressure every single day. So light pressure, non-abrasive materials, fluoridated toothpastes twice a day.
Okay, that I think was one common myth, that we need to have fluoride in the toothpaste and not a non-fluoride one. So I think that's also a very common myth that parents have in their mind, that they should use a non-fluoride toothpaste for the younger kids. I mean, for the kids below the age of, say 2 to 3 years.
No,
I'm not
Shweta,
sure.
again, here I will tell you that any sort of toothpaste, you can use a fluoridated toothpaste for a younger child, but if the child is not able to understand whether or not to swallow it, then it's better to use a non-fluoridated toothpaste, because when fluoride is ingested, it is not very healthy for the body. The baby will have an upset tummy, the baby might vomit it out. So fluoride should not be ingested. So if you insist on using a toothpaste before the child, where there is a possibility of the child swallowing it, then please use a non-fluoridated toothpaste.
And it's fine. I mean, it still cleans the teeth in the same way.
Yes, it's essentially soap for teeth.
Acha, okay, nice. Thank you. So there is another question. My 9 months baby is always rubbing his ears and dribbling. I have given him some silicone teethers. I don't know how to help him properly. I don't know if this is related to teeth. Is that connected?
I will not be answering the query about the ear part, but if your child is, what's the age of the child?
9 months.
Yeah, so the child is in the age where he or she is teething. So if you can see an evident bump on the child's gum, then specifically on the upper jaw right now at this age, then please give a good clean teether to bite on, and the child should be okay. Just make sure whatever the child is putting in mouth to bite on is clean.
Right. Priyanka has a question. Will the gums adjust itself the size, because milk teeth are very small compared to the permanent teeth, and after milk teeth is removed, the permanent tooth doesn't have space?
Yeah, so if the milk tooth is removed untimely, ideally what happens is, when the permanent tooth is ready to erupt in the oral cavity, it will start pushing the milk tooth out. Okay, and the root of the milk tooth will start dissolving on its own. And when the tooth eventually falls off, you will just see the part you see inside the mouth. Just the crown of the tooth will fall off, because the rest of the tooth has been dissolved by the pressure which is impinged by the permanent tooth. So that is a natural process and a painless process. And then the permanent tooth erupts. Okay, but if your deciduous tooth or the milk tooth is removed untimely, then the other teeth will migrate in that position, because it's a tendency of your teeth to keep moving unless they hit a stop in some way. Okay, so if, for example, if a lower tooth is removed, the upper tooth will supra erupt and grow down till it hits the gum and experiences a stop. Same way, when a tooth is removed, they will migrate like this horizontally and tilt, so that they hit a stop and then stop migrating. They will block that space for the permanent tooth to erupt.
Oh, okay.
So this will eventually lead to crowding, or in some cases, the permanent tooth might not be able to erupt because of lack of space.
Right. Okay, so okay, we'll come back to the toothpaste question because Minu has that question. Any toothpaste brand recommendation for when they have sweet tooth, especially when the kids have sweet tooth?
I would discourage you to give a sweet toothpaste to your child, because then it becomes a hassle to transition into a regular toothpaste. So it's a good opportunity for you to make the child accustomed to regular tastes of a toothpaste, which is not very sweet. But any brand is okay. I mean, I will not recommend any specific brand because all of them eventually have the same composition. So any over-the-counter toothpaste for kids is good enough for kids under 6 months, 6 years of age.
6 years old. But some kids might tend to swallow the toothpaste by mistake. It's not like they do it deliberately, but it may happen that suddenly there's a choke, they swallow the toothpaste. So is it any harm if they swallow the toothpaste like that?
So when they swallow it by mistake, then the quantity is very negligible. In that case, it's completely okay. But there are times when when parents find their kids with the tube sitting on a bed or somewhere with the tube and just eating it like a snack, So and if it's a fluoridated toothpaste, then immediately give your wash your child's mouth thoroughly, remove all the remaining part from the mouth, and give your child a good cup of milk. So the milk will go in the stomach combined with the fluoride and prevent it from being absorbed into the body. So that is one way of reducing the fluoride being taken into the system. And secondly, rush to your pediatrician. It usually maximum it will do is cause upset or vomiting in the child. Once it's out of the system, your child will be okay. But you should always consult a pediatrician if you catch your child eating a toothpaste like snack, because that happens more often than we
that's
than
true.
we care to admit. Yeah.
Yeah, I agree to that. So some kids have this tendency of keeping the mouth wide open, either while they're awake or while they're sleeping. Does it cause any harm? Any suggestions how we can avoid them?
Yeah. So mouth breathing is it will not cause any harm per se. First of all, when a child is opening their mouth for breathing, it means their nasal breathing is not happening properly due to some reason or the other. So that needs to be looked into. Uh, the child is opening their mouth a lot, which means the mouth is going to become dry more often. Because of the air, the mouth is going to become drier than usual mouths. So in that case, when the mouth becomes dry, again, the salivary protection reduces and the teeth are more vulnerable to decay. So in that case, first, please identify the reason why the child is a mouth breather. If there is no particular reason as such, then you can train your child to keep the mouth closed. But if the child is breathing through the mouth for a reason, then once you correct that reason, that problem is going to go away.
Okay. Swati has a question. My son is 26 months old and has 20 teeth. I haven't visited the pediatric dentist till now. I want to know how much this visit is important and how soon one should visit the pediatric dentist.
Yeah. So I will combine these two questions. When should you first visit your dentist and at what age?
At what age? Yes.
Yeah. So firstly, let's all acknowledge that it's scary to go to a dentist even for adults, right? And when we want to make our child get used to a particular environment, we usually take them to that environment very gradually. We expose them to that environment multiple number of times without any particular uh, pressure of having any activity in that place. So that's exactly how you should introduce your child to a dentist at 1 year of age. So after the baby finishes the first birthday, start taking your kid to your family dentist or a nearby dentist. Just expose them to that environment, the noises, because the most intimidating part about a dental clinic is the noise, the setup, the people in white coats, the people with all mouth masks, and the serious environment. So expose your child to it. Let the doctor and the child become friends with each other. Your child should not have any dental problem for you to visit a dentist. You're just acclimatizing the child to that environment. Because when your child actually needs a treatment, then the child is in discomfort, is in pain. The parents are already stressed out because the child is not sleeping, they have not slept. So the entire family is distressed at that time. Now you go to the dentist, the baby is going to take the entire clinic on its head by crying, and baby scream there, right? So for pediatric dentists, the biggest challenge is cooperation from the baby. The treatment is the most easiest part of the entire process. Cooperation of the child is first.
First.
So to make your child cooperate, expose them to the environment, to the noise, and remove their fear of that. And after that, from 1.5 to 2 years, you can start visiting your dentist once every 6 months. So 2 times in a year, and make the child used to the instruments. Because at home, we tell them that playing with sharp objects is not good for them. It will poke them, it will hurt them. And when we go to the dentist, we tell them, open your mouth and let the doctor put the sharp object inside your mouth.
Yeah.
So we are contradicting our own teachings there also, right? So make the child used to sitting in the dental chair. You as a mother, you can sit and make the child sit on your lap so that the child feels protected. Expose them to the dental instruments when there is no issue, so that when there is a problem that needs to be treated, the child will be receptive towards it. They will still cry, but they are more receptive towards it.
Yeah. So preparation is a lot more important than actually taking them to the visit first, or getting it checked first, I would say.
Yeah. And so to answer your question, it's okay. It's about time you can take your child for a regular dental checkup, and it should be okay.
Okay. So Swati, I hope that answers your question. How long will it take for the permanent teeth to erupt? My girl's milk teeth started shedding after her 5th birthday, but many incisors are not yet erupted back. How long can it take? I think you have answered this question already.
Yeah,
But
from
yeah.
6 years of age, often there are a few cases where the milk tooth has exfoliated or fallen off and the permanent tooth hasn't erupted. So you can just ensure by taking an X-ray at the doctor's clinic that those teeth are there inside, and whenever they get a stimulus, they will erupt. So if they are there inside the bone, then you don't have to worry about it at all.
Okay. Devi has a few questions. She says, could you please suggest what type of toothbrush can be used for a 17-month-old baby? And her second question is, does tooth eruption in babies cause change in poop color or consistency? If so, does it happen for each tooth? That is.
Yeah. So for 17-month-old, of course, the child is already on solid food. So you can use a baby brush like this, a regular baby brush, but the bristles have to be very soft, because when you're brushing somebody else's teeth, the gums are extremely sensitive to hurt. So even if a soft bristle is piercing your gum, it is very painful, and the gums are always very reactive because they are highly vascular. There's a lot of blood supply inside your mouth. So when there is a little bit of poke also, it will bleed unintentionally also. So use an extremely soft bristled normal toothbrush and brush your child's teeth twice.
Twice.
As far as the poop color the question that you're asking me, the poop color is not at all influenced by the eruption of your teeth. It is influenced usually by a lot of other factors, and food being one of those factors. So if your pediatrician will tell you more about that, but it is not at all influenced by the teeth eruption of your teeth.
Right. One more common question I'm seeing in the comments is, how frequently should we be changing the brush? Whether it's the finger brush or the regular toothbrush, how frequently should it be changed?
Every 3 months. As a rule of thumb, you should be changing your toothbrush every 3 months, whether it still looks like new, whether it is completely gone flat because of brushing, or whatever reasons. After every time you have a bout of viral illness, change your toothbrush. And after every 3 months, please change your toothbrush at any age. If you're using a toothbrush with nylon bristles, then please change it every 3 months.
Right. Usually when the babies are keeping the bottle in their mouth for a long period of time, or even while drinking, they say that the teeth kind of erupts in the front, or it kind of moves a little forward. So don't give bottle milk to the kid. So how true is that? I'm not sure actually, but I have never done it, so I don't know the answer.
It's not very true for the bottle, because the way the bottle is held in the mouth is very different. The seal is created by the tongue and a lot of cheek movement. But finger sucking is a major reason for misalignment of teeth. What happens when the child has a habit of finger sucking? They will put their finger like this and rest it on the palate over here.
Okay.
Over here like this, right? So there is a pressure on the palate here, and there is a forward pressure on the front teeth over here. So in such cases, we typically see a beak-like formation of the upper arch. So instead of a U shape, we see a V-shaped arch formation because of the pressure that is exerted by thumb sucking habit. So finger sucking habits definitely tend to have these long-lasting effects on the bone structure and the alignment of teeth.
Right. Do you recommend using electric brushes for
Yeah,
kids below 6 years or?
Okay, so electric brushes, all they do is they replace manual effort with electric effort. Everything else stays the same, right? So what you could do is let the child develop its own dexterity. When the child is brushing his own teeth, there is a lot of finger control, a lot of muscle control required by the hand muscles to actually end up brushing your teeth properly.
Right.
In that case, you should wait till the child develops their own dexterity and then switch to electric toothbrushes. So it's okay to switch because all they are doing is replacing the manual effort. But till your child understands where to brush, how to brush, and when to brush, the electric toothbrush is not going to add anything more to it.
Right. Aishwarya, in fact, has a very basic question. What is the proper method of brushing the teeth? I think we missed that question. We should have started with this.
Yes.
Yeah.
So I'll just, is this visible? Is this model visible to you?
It is. It is.
Okay.
Yeah.
Okay. So when you're brushing, your toothbrush goes at a slightly 45 degrees angle. So having it right across your teeth is not the best way. Your gums have a little bit of pocket, 1 or 2 millimeters of pocket before they actually attach to your bone or your tooth. So have your toothbrush held at 45 degrees angle slightly to the tooth and then brush.
Sorry to interrupt. If you could just raise it up a little.
Okay, and then brush properly. Okay.
Okay.
Then for every tooth, you can have 2 to 3 strokes slightly horizontally with less force, then 2 to 3 strokes vertically so that the vertical gaps between the teeth get cleaned, and then a round motion. Okay. While brushing, please target only 1 or 2 teeth at a time. Just having random strokes, untargeted strokes will not clean your teeth. You should give good 1 to 2 minutes of time for brushing every time you're brushing. So target 2 teeth, have a slight tilt of the brush towards the gum so that the gap within the gum also gets created where a lot of food gets accumulated. And a few strokes vertically, a few strokes round on every tooth, then move to the next tooth. A very minimal amount of pressure needs to be applied because even if you see, even when you keep a stone with a lot of water flowing over it, the stone also tends to lose a lot of its own structure. The same happens with teeth also. When you're brushing your teeth with a lot of force, you are eventually abrading your own teeth. So you need to apply very little amount of pressure. You should be aiming towards polishing your teeth and not towards abrading your own teeth. Ensure that every surface of your tooth is brushed. So we usually just concentrate on the outer surface of the tooth, right? So the chewing surface also needs to be brushed with equal amount of care. For that, you just need to keep your brush on the chewing surface and have a few strokes. The same for the lower teeth, the side of the tongue, the lingual part also needs to be cleaned with a lot of care, and horizontal strokes for the posterior teeth, and for the front teeth, they need to be cleaned like this. Okay, not horizontally like this, but with vertical outward strokes. Okay. And for your upper teeth, again, the palatal side or the back side of the front teeth needs to be cleaned with vertical strokes like this. The chewing side needs to be cleaned with horizontal strokes like this. And the inner side needs to be cleaned with vertical strokes again, and not horizontal strokes like this. The side towards your palate of the upper posterior teeth. Okay. Then please do not miss out on cleaning your tongue every time you brush. And for every tooth that sticks together, if there are 2 teeth that are sticking together, flossing is a must.
I was about to ask about flossing also now. Yeah.
Flossing is not an option because that is the part where your toothbrush will just not reach.
Right.
So if you've never flossed, it means the area between your teeth, which definitely harbors a lot of food, has never been cleaned till today. So please learn the right technique of flossing and ensure that you floss every single day. It is not an option.
Nice. There was one question that I wanted to know was, some babies have delay in eruption of teeth. I mean, in the initial stages, as you said, 6 months is when it starts, but some have it at a very later stage. There are kids who have even crossed 1 year, may not have their first tooth also erupted. There are situations when I have come across that. So is it common? Is it normal? Please, can you?
It needs to be looked into. And if the reason is just delayed eruption, if the teeth have formed within the bone, the one thing we need to ensure that the teeth are formed within the bone. A little bit of delayed eruption is okay. But if they are formed within the bone, then they will erupt at one point because it's a natural process of the body to give stimulus to the tooth to erupt into the body. So they should be formed, get it diagnosed from a doctor that the teeth are there inside the bone. That's all you need to be worried about.
Right. So, I mean, I think the questions, I will keep flowing out with a lot of questions. When it comes to oral care, I think we as parents, we have so many questions at different stages, maybe because my daughter is now going to be 6 years old. It's the stage when her teeth is about to fall. So I have so many questions related to it, but it's really not fair to have this live session on for it. I think we should block another time of yours and ensure that we get you on Tribe one more time to have a proper AMA session with you, which is only about answering these questions. So we'll definitely connect with you again, Dr. Potdar. We really thank you for sharing this space of your day with us and sharing so much insightful information with us about oral care. It's been again another insightful session that we've had for our tribers. Thank you so much for being here today. Before we all go, I would love to take a picture, so I'm going to unpin both of us. I want all of you to please switch on your camera, smile properly. I'm going to capture a proper picture of all of us. So yeah.
Let me thank all of you for tuning in today. Thank you so much for being here and being so proactive. All the cute videos on the Tribe were really heartwarming, and a big thank you and a big hug to all those wonderful kids who are so curious about your dental hygiene. Thank you so much, Shweta, for inviting me today. Thank you once again.
It's our pleasure. Thank you so much, Dr. Potdar. So all of you now quickly smile. Give me a wide, big smile. And if the little toddlers are there around, get them also on the camera. Let's have them smile with us. And I'm going to quickly capture the image. Ready? 1, 2, and oh, okay. 1 second. Sorry. Okay. 1, 2, 3. Smile, everyone. Shashti is here. Okay, let's smile together. 1, 2, 3, smile. Yes, very good. Stay on. Just hold to it. I'm going to capture the next screen as well. Okay, keep smiling, all of you. I see a lot of cameras being off. Please switch on your cameras. I can take another picture. So great. Thank you so much. Thank you so much for patiently being with us on this evening and listening to us. I hope we have got you a session which has been interesting and which has been insightful, and this is giving you a lot of information. Thank you again, Dr. Potdar, for joining us on this evening. All of you have a great evening. Have a great weekend ahead. We'll see you again on the next session. Thank you so much.